Just as every organisation has a trained first aider to hand in case of a medical emergency, so too should they have someone trained and available in the event of a mental health issue. That's the thinking behind today's training course in Edinburgh.
First aid for mental health is something we look at in terms of helping organisations to help their people in terms of their well-being, in terms of being careful around their culture, around the well-being and how we can help individuals to better care for themselves, but also how can we support others within the workplace as well in terms of their mental well-being. There's lots of things we cover over the 2 days. It's a pretty full 2 days. There's a bit of theory. We talk a little bit about mental health and mental illness, the differences between the two, and first aid for mental health, and we look at some of all the different sort of conditions from, depression and PTSD, anxiety, and a variety of other ones. But when the real value comes from the days is the guys having the opportunity to understand what's really expected and what they hope to do in terms of a conversation as a mental health first aider. So if there's somebody within their workplace who's struggling with their mental well-being, knowing that there's a first aider that they can go and speak to, and just kind of giving them some of the hints and tips and techniques around how to have those conversations. So the guys have kind of broke off into pairs this morning, and they're spending a bit of time working with each other around different conditions to kind of role play and what that role play will look like. And we kind of covered it, and we'll cover it in a wee bit later on, around setting the scene, making sure it's a good environment for the conversation, talking around confidentiality, and then really key things like listening. 2 ears, 1 mouth, as they always say. It's really, really important just to ask really good open questions, make the other person feel relaxed and supported, and very important that we're non-judgmental, and then just let that person have an opportunity to talk, someone they can talk to, and then listen, do as much fact-find as possible, and then hopefully be able to kind of help that person themselves in terms of offering some self-help strategies, but also kind of directing them to some of the right professional support as well, because it's a great course and we spend 2 days really getting into it, but we're totally aware as well that we're not going to be medical professionals at the end of it, so it's really, really important that we are helping people then to get the right professional support that is out there as well.
So I guess for me it's kind of a bit twofold. So from a professional perspective, our company's gone through quite a lot of transformational change, if you want to call it, over the last kind of 18 to 24 months. And understandably it's been quite difficult for people. There's been a lot of change. We've gone through our first round of redundancies in 21 years, I think. So it's made everyone feel really unsettled. So I guess from a professional perspective, I want to be able to support people in a tangible way. I'm kind of naturally quite a positive person anyway, so it was kind of a bit of an obvious choice for me to do it. But also from a line management perspective, things are changing a lot in terms of people's roles and the company structure, so it's kind of knowing how to support people properly rather than just chatting to them. But then from a personal perspective, I've suffered, or I'd hate using the word suffered, but I've been affected by depression and anxiety for, quite a few years. And again, I've done a lot of work with professionals, but also myself, to try and get myself in a much better headspace. And it's almost kind of trying to channel that pain into something positive, so that it's kind of not all been for nothing. And again, I guess I would hope that puts me in a position where I can be empathetic with people, because I won't necessarily understand exactly what they're going through, but I'll hopefully understand the kind of general feeling that it can bring, and my personal experience should hopefully make me quite a good first aider, I hope.
Yeah, I think the accreditation, it just helps add a bit of credibility, maybe a bit of gravitas to the course, and also it's great for the guys who come and attend the course. They go away with a qualification as a mental health first aider, which really probably helps them when they go back into the workplace, not only having the skills and the knowledge and all that great empathy because they want to help people, but also with a bit of kind of qualification in the background as well to hopefully really help those conversations.
The qualification and accompanying skills employees and trainees hope will provide much needed support in the often pressurising and stress-inducing work environment. Ian McNally, That's TV.